So we've been talking about cause versus symptom. We've been talking about how to determine what some of the possible causes of your condition might be. And we've talked a lot about customizing plans for you, customizing what's going on with you, and exploring to figure out exactly what we need to do to help you feel better and help your body function better. So how do we do that? How do we explore these pathways and figure out what exactly you need? Well, we have several ways that we do it, but before I go into that, one of the things that you need to understand is how lab values work, okay? And a lot of patients that come into our office, they'll come in, and my first question to them, they'll be presenting with symptoms, for example, of brain fog, can't lose weight, no energy, intolerance to cold, a bunch of symptoms that go along typically with what we call hypothyroid function. And I'll ask them, I say, do you have a thyroid condition? And inevitably I'll get one of two answers. Yes, I do, and I'm on medication and I'm still having these problems. Or I've gone to my doctor, I've had my thyroid checked, and everything comes back normal, but I'm still having symptoms. So the general overall question in a thyroid patient, for example, is, why is it that my lab values are normal, or I'm doing what I'm supposed to be doing, but I'm still having symptoms? Okay, well, I'm going to go into that in detail with you when I go into thyroid metabolism. But specifically with labs, I want to explain to you how it is that you may go in with these symptoms and your lab values come back normal, but you're still having a problem. Okay, so I'm going to show you how this works. So basically, the way that the lab works is they take a collection of all the patients that come in and get lab tests done. Okay, and then they will take all that data and they'll take that pool of information and they'll determine what the average is for that patient or for that specific lab value. So we'll talk about TSH, which is thyroid stimulating hormone. So we're talking about TSH. So they'll determine what that point is. Now keep in mind, when they're determining this point, they're taking in all of the patients that come in and get their labs done. Well, who gets their labs done? Usually patients that are sick. So we're determining a normal value based on sick patients. Now, some people do go get regular lab checkups, but the majority of patients that come in and get labs done is because they're having a problem, especially in our society, because we are a very symptom-oriented society. Insurance won't cover you doing wellness labs. So you have to have a symptom to be able to justify running the labs. So, and we're using numbers for TSH, for example, that are from back in the 1960s. They haven't changed very much in that time frame. So for TSH, for example, the normal in most labs, now some labs differ, but in most labs, the normal situation would be 0.5 to 5.0. So if you go in and you get your labs done, and let's say you're sitting at 4.75, well, it's going to come back and say, hey, your labs are normal. Your doc's going to look at it, say your labs are within normal ranges, you're fine. Now, there's a good thing and a bad thing to this. The good thing to this is when you have this wide lab range, then you don't have a lot of people getting on a lot of medication, because there are side effects to medication. So there's a good reason for them to not want to put you on that medication until you get so much dysfunction that it's absolutely necessary to do something about it. Now, medication sometimes is necessary, but a lot of times you can handle it without that. So 4.75, you're normal, okay? So that's how normal lab values work. Or if you're on the other end here, let's say you're at 0.75, you're still sitting at the normal range. So the way that we look at it as functional nutritionists is we actually look at optimal. Okay, so we're wanting to see what is optimal function for this specific lab value. So instead of going with this 0.5 to 5.0, we're looking at 1.8 to 3.0 is what we want to see for that. So when you come in to see us and we look at your labs, we'll say, okay, you're at 4.75, you're normal for the medical situation, you don't need medication or anything like that. But from a functional perspective, you're moving into a hypothyroid condition. And if you don't understand why this means hypothyroid, you will soon, because I'm going to go through that. But you're moving into a hypothyroid position, so we need to address this now, because it's a lot easier to address something here than it is when it's out here at 6.5 or 20.5 or however high it's going to get. It's a lot easier to address it there. So that's the difference between normal lab values and traditional lab values versus functional lab values. And so what we do is we take these functional lab values and we apply it to a specific set of lab tests that paint a picture for us so we can see, okay, what kind of causes are we looking at for what could be causing what's going on with you. So this is one of the ways that we look at it. Okay, these are blood tests, lab values. Also, we use urinalysis tests that are done through your traditional labs. Okay, so it's March, and this is the time of year where everybody's wanting to get active because the weather's getting so much better. You can see all the joggers getting out and starting to get into exercise programs. And a lot of our patients, especially a lot of our people that have opted in for more information about our thyroid program, this is when they really start to notice the effects of how they're feeling, because they can't get out there and do the things they want to, or they're not willing to go out to the beach because they're not comfortable with how their body looks and they're not confident in themselves. So we do this special in March because we want to help you reach your goals and help you get back to a normal life. So what do these visits include? Well, the first thing we're going to do is we're going to do a complete case review. I'm going to have you actually come in and share with me what your story is. I want to know detail to detail what exactly has happened. I actually have most patients write down their stories so that we don't miss any of these details, because a lot of times, the devil's in the details. A lot of times we can find clues to let us know where we need to explore to figure out what's going on with you. So we're going to go an in-depth, deep case review and history with you. We're going to review labs that you've had doctors run for you in the past. You're going to bring those into me, and I'm going to sit down and I'm going to review these for you. I'm going to review your case and figure out what is going on with you. The next thing is we're going to do a goal review. What are your goals? Do you want to lose 30 pounds? Do you want to just get the energy to be able to function through life, to be able to play with your kids when you get home from work? Do you want to get your sex drive back? Do you want to feel like you again? What exactly are your goals? And then we set up realistic expectations to know when those goals will be met and what might have to happen for you to achieve those goals. We're going to do a complete neurological evaluation. We talked about how brain function is so important to the overall ability of the body to heal itself, and we need to determine, is there transneural degeneration? Are you losing neurological function and don't even know it yet? We're going to find that out. We're going to do x-rays if necessary. We're going to study what the structure of your body is doing so that we can know, structurally, is there an issue that's keeping you from healing? If they're medically necessary, we will do these x-rays and we'll figure out what, again, is going on with you. We're going to do a complete neurological evaluation. Metabolic evaluation. In the lab review that we talked about, I've got very specific questionnaires that you're going to fill out. We're going to know how your thyroid's functioning. We're going to know how your adrenal glands are functioning, your kidneys. We're going to know how your liver, your gut, how your body's processing sugar, how your brain function's occurring, what your neurotransmitters are doing. We're going to know all this stuff by the time we're done. Then we're going to sit down and we're going to go through a report of findings. And I'm going to report back to you everything that I found. You're going to learn more about yourself in that appointment, and you're going to understand more about what's going on with you after that appointment than you've ever known before. At that point, we're also going to go over any financial obligations. If you have insurance, you'll know about insurance coverages. If you have any out-of-pocket, you'll know what that'll be at that point. And then we also offer one complimentary session if you're a patient that does qualify for our program and someone that we feel like we could help you. And let me tell you right now, if you qualify for our program, there's nothing out there that's going to help you like this program will help you. If you don't qualify for the program, I'll help direct you in the right direction of where you need to go to get help. But if you qualify for our program, we're going to go ahead and include a complimentary session for you to come in and see what a treatment is like in our office, see what a brain-based treatment is like, see what we do to try to help you heal and help you get better. So this is a total of 3 visits. The first visit is where we're sitting down and talking and reviewing everything. Then I'm going to take all that information and I'm going to sit down and write up your report of findings and write up your plan for what we're going to do for you. On the second visit, we're going to sit down, we're going to talk about that report of findings. I'm going to explain to you exactly what's going on, show you what your plan is, and then the third visit, you're going to come in, you're going to get the complimentary treatment to see what you want to do. Now, the total value of these visits is between $450 and $500. That's for 3 visits in our office, quite possibly about 2 hours of my time dedicated to your case to figure out what is going on with you and what we can do about it. And again, it's a cost of between $450 to $500. A lot of times we'll offer special offers for this where you can come in and do this for discounted rates. But for March, we're trying to encourage as many people as possible to get back to normal life. So we're going to do this for $27. That's all 3 of these visits for only $27. The catch is you've got to be in here and get this done before March 28th. That's a Thursday. You got to be here before March 28th. If you come in March 29th, or if you schedule your appointment March 29th, it's going to be the full fee. Okay? So give us a call, take advantage of this. Phone number is 850-862-2224. You cannot lose. You're going to learn more about yourself. You're going to have 3 incredible visits into our office. It's going to be well worth your $27. I highly encourage you to do it. Okay? 862-2224.